All right. Hi, everybody. Just want to apologize in advance. I have a little bit of a scratchy voice today. Daycare virus 3012 of the summer. So I hope you guys are able to hear me and understand me. Give me a little grace if I need to slug a beverage in the middle of this presentation. So thank you so much. All right, let's get started. Yeah. So if you haven't yet connected to WebEx, I wonder how you're listening to me, but once you join the meeting, there are various ways to connect your audio. So if you've got a wonky internet connection like I do, there are different methods that you can use. My favorite is the call in or call me option, where I put my cell phone number in the call me button and then click go and it calls me. It's much more reliable usually than my Wi-Fi. All of you will automatically be on mute upon entering the meeting, so please don't hesitate to use our Q&A panel to ask any questions that you might have. Speaking of our Q&A panel, this is what it looks like. It should be at the bottom right-hand corner of your screen. Make sure that when you are asking a question using our Q&A panel that you are putting your ask to all panelists, which allows me and the other presenters and panelists to be able to see your question, all of them. So set it to all panelists, type in your questions, and send them on in. All right, so here's our agenda today. We have a couple of announcements, then we'll go over our survey results from July, and then get into our presentation today on backup planning. Well, as you may know, August, back to school month. I saw some cuties waiting for the bus this morning by my house as I dropped my kiddos off. Nice to see all the parents standing there out on the bus stop with them. And good to know that, I won't be the only parent standing out there with my kiddo in 3 years when she eventually goes to kindergarten. So yes, so happy back to school to all the parents. But also for all of us, back to school can be a really busy time of year. So those of you who have folks who are in school, it's important to check up on their support plan. They may have changes in goals or changes in supports that may be coming up. So again, due to those changes, school schedules, other circumstances, their support plan and the services that they receive may need to look different going into the school year than it did over the summer. So check in with the people that you serve and their families right around the start of school time. Some questions that might be helpful to ask when you're checking in with those folks. Will your services and how they're being delivered continue to meet your needs during the school year? Is there anyone at school that the case manager or support planner should have permission to share information with? And is this a big transition year that requires additional coordination? So maybe a new school, maybe graduation, maybe starting new programs or supports at school. Asking those questions can really help prepare the case manager, you guys, for updating the support plan, updating service authorizations, and providing additional direction to providers. Additionally, as people and their families are preparing for what's next, we do recommend that every family check out the tools and resources on the Disability Hub MN on the For Families page. There is a link at the end of this presentation in the resources section for the Disability Hub MN. Otherwise, just go ahead and Google it. It'll pop right up. But that For Families section is really helpful for those folks that are working with us. On to our July survey results. It looks like we only got one survey in July. We have double checked and our surveys we're in working order. So for all of you listening today, we'd really appreciate it when you close out of this presentation, the survey will automatically pop up in a new window. We'd really love you to fill out the survey because we use your feedback from those as well as the questions that you ask during the presentation to create online modules. And we're going to be using those online modules moving forward to help train new and existing case managers. So all of your questions, all of your suggestions are reviewed and applied to our content to make it better. So please do take some time and fill that survey out. The survey that we did receive was pleasant, and the comments were positive. So thank you for that. But if you guys could all just take a few moments and fill that out, we'd greatly appreciate it. All right, so let's get into our Building Your Skills series presentation for today. Again, just to kind of remind you, DSD and Aging and Adult Services heard feedback from you, the case managers, care coordinators that we work with. The training is needed for care coordinators, case managers, and assessors who build support plans. What we're intending to do with these classes, as I said before, is we're using this as a pilot opportunity to really get this content out there, receive your questions and your feedback via survey, and then use that feedback to create online modules. This is really foundational training. It's meant to be basic because we're using this again to build that foundation for online training. So I would love it if my fellow presenters could introduce themselves today. You could pop on camera. We have less folks from DHS here today. Of course, the holiday weekend coming up and some vacation is on the docket here. I'll just introduce myself first. My name is Lauren Harrington. I am a case management training specialist with DSD. I am a 40-year-old white woman with shoulder length blonde hair, and I'm wearing a pink t-shirt today. And I would love it if my fellow presenters could come on camera and introduce themselves as well.
Hi, can everybody hear me? Yeah, okay. My name is Megan Malumbi. I use she, her pronouns, and I'm a white woman in my 30s with blonde hair that's pulled back into a clip, and I'm wearing a large headset. I'm sitting in my office and have a few plants behind me. I am case management policy specialist with the Disability Services Division. Nice to see you all.
Good morning, everybody. I'm Victoria Stelfox. I'm the support plan policy specialist. I use she, her pronouns, and I am 41 years old, a white female wearing an orange top with blonde highlights. Hope everybody has a good day today.
Hi, everybody. My name is Kathy Vondrum, and I am the support plan and case management specialist for Aging and Adult Services Division, and I also am the MnChoices policy specialist in our division also. And I currently do not have my camera on.
Thank you all. I appreciate you guys being with us. These are the folks that'll be working as panelists behind the scenes to answer any questions that may come up or to see if we can research the answers to your questions. As you can see, we only have a few folks on to do that work, so we may not be able to answer all your questions today. But again, we're going to take those questions over the Q&A panel in WebEx. So use that to ask questions. If you have feedback for us, please again use that survey. It's kind of the two separate methods that we're looking at to receive your feedback. Questions in the panel that you type in are only going to be visible to the panelists, not to all of the other participants. So just so you know, if we don't get to your question today, or if we're not the right folks to answer your questions, you can definitely send those to the appropriate division contacts, the DSD contact form, or you can email Aging and Adult Services directly, and we will get those answers to you as soon as we can. So today's presentation is episode 13. I'm so excited for lucky number 13, and it is on backup planning. So far in our previous episodes, we've discussed kind of top to bottom the assessment process, the assessment results, including how those impact our support planning process. We've also talked about the importance of researching and gathering information about service and support options so that we can help that person make an informed choice. We've also talked about information that we want to share with the person to prepare them for their role in building their support plan. And we've talked about support types. This concept includes things like people and community, assistive technology, and also services. We did have a presentation in regards to consumer directed community supports, or CDCS, and also a presentation talking about own home and provider controlled options for the folks that we serve. We've also been talking quite a lot about informed choice requirements and their importance, and the concept of dignity and risk and its dignity of risk and its relationship to the informed decision-making process. So if you missed any of these presentations, any of these episodes, and you want to find out more about topics we've already covered, you can find them on the DSD training archive page. We do have a link for that on the resources slide, but I always like to just Google MNDHS training archive, and it's the first link that pops up. Know that you do have to scroll down the page to the building your skills section, but all of those training presentations are posted there for you to review. So our learning objectives for today, when this training is complete, you will be able to explain the purpose of a plan, backup plan, excuse me, both for the person and for their team. Not really sure where the word backup went there. Summarize the care coordinator and case manager's responsibility for backup planning. We also want to talk about the process of creating a backup plan and recognize the case manager and care coordinator's duties as a mandated reporter. So again, when we talk about the person, we do really mean the person that is receiving services. We know that some people may make decisions with support from their families or their legal representatives, but we're going to use the person just overarching through this presentation. So let's talk a little bit about backup planning. Why backup planning? Why is backup planning so important? Well, things don't always go as planned. When we think about and prepare for unexpected or emergency situations, we're more likely to follow the plan and increase the likelihood that we're going to stay healthy, safe, and have our needs met. It's important to have that plan B for when the first option doesn't work out. So what would you do if you were these folks and your bike tire got punctured? What if your chain fell off? What if you have an awesome ride, but you didn't bring any snacks? What's your plan B? So backup planning really truly is for everyone. So think about some situations when you needed help in your life and something doesn't go as planned. I know this one intimately. What would you do if your daycare provider is closed or if your caregiver called in sick? What if you get sick or injured? What if you're counting on a family member to help and they don't show up? What if you're late for the bus and you miss your ride home? So we all think about and have backup plans in our lives. And many of us have even filled out emergency contacts at our place of employment because stuff happens. Also impacting the folks that we work with is really truly the workforce shortage in Minnesota. It's impacting people with disabilities and older adults as they struggle to find care in their own homes and communities. So it's critical to develop backup plans specific to staffing emergencies right now. Some information about that workforce shortage. Here is a chart that shows the number of current people working as home health personal care aides. That's a job classification, which covers anyone who does one-to-one work in the home or employment settings or in direct social service types of jobs. But it's not considered professionals like case managers. So this graph really shows a needs projection of growing reliance on direct support staff if support plans continue to rely on direct support workers and in-person services. We got this information from labor market information and deed projections, so departments that we work closely with to get data to show us the importance of what we're doing. So again, hopefully this demonstrates to you the importance of backup planning in relation to staffing needs, because the need for direct care workers is only going to continue to grow. It also demonstrates the need to be creative with supports and backup planning to help meet the person's needs when a staff person isn't available. And we'll talk about that more later. So again, this information did come from the Labor Market Information Office at DEED, and it was pulled on August 23rd. So these are very recent projected numbers. So backup plans also allow a person to make an informed choice before an emergency occurs. So if a person has time to think about an emergency backup plan before that emergency, they're going to be able to receive their preferred support when that emergency occurs. And they'll have had time to think about their goals and their preferences and to make a choice instead of feeling like they have no choice at all and it's an emergency and they're rushed. Backup plans also help to ensure that the person's support plan meets their needs. You've done all this work with the person to create a support plan that addresses their needs, their preferences, their goals. But we all know, despite the best written plans, sometimes the plan falls through. A well written backup plan really helps to ensure that the person's needs will be met when their first choice doesn't happen. Having a backup plan ready just in case ensures that they'll remain supported when that planning doesn't happen. So what are the care coordinator and case manager's responsibilities regarding backup planning? Well, case managers and care coordinators play a critical role in supporting people to make an informed choice about their service and support options. And that also includes informing people of their options should their first choice become unavailable. We're going to talk about a lot of resources during this presentation, and all of those resources that we talk about in this section can be found really on the CBSM Guide for Emergency Backup Planning page. Also, this document, this PDF of this presentation should have been sent out to everyone who pre-registered for this training. So you'll be able to open up that PDF and click on these links. There's also a huge resource section in the back of this presentation that all of these are duplicated on as well. So developing the plan. To support people in developing and monitoring their backup plans, case managers and care coordinators must provide an informed decision-making process for the person and their legal representative, if applicable, for services and supports. And we talked about that informed decision-making process during our last episode. They also must finalize the support plan, which includes discussing and documenting that backup plan with the person. Case managers and care coordinators also need to provide ongoing monitoring and assessment of the person's services as identified in their support plan, including monitoring the person's needs and the adequacy of that support plan. They also finally need to review and understand provider backup plans if the person receives home care services, including PCA services, or if they reside in a provider-controlled residential setting or in receiving any other essential services. Providers will also have those backup plans. The case manager also needs to provide information to the person. The case manager or care coordinator has to discuss and develop those backup plans with the person and maybe their legal representative. They also need to provide information to ensure that that person can make an informed choice about the people, organizations, providers, services, and technology that might be able to provide support to that person when something doesn't go as planned. It's really something personal to each person you serve. There isn't a form for backup planning or a checklist for backup planning because it has to focus on that particular person and their needs and their desires and their preferences for service delivery. So, like the support plan, a backup plan can and should include things like informal supports like family members, friends, community organizations. And it should also explore preferences and choices with the person. It could lead to identifying some unique and innovative backup supports, something that's not necessarily part of their regular list of options. So consider each person's strengths, their needs and supports. They're all unique to each person you work with, and a backup plan should reflect each person's individual circumstances and each person's choices. Some topics to think about when we're talking about backup plans, things like short-term staffing needs. The staff person is late, they didn't show up, what are we gonna do? Planning for long-term staffing needs, like maybe a staff member resigned or that person's unable to work. Maybe their primary caregiver is unable to care for them any longer or for, an extended period of time. What if the provider terminates services or a residential site closes? Some of those considerations can really spark conversations as to what we can put on a backup plan for that person. So things to talk about also, who the person wants to receive services and support, who they want to receive support from when staff are not available. So family, friends, organizations, other providers, assistive technology, formal and informal caregivers, and what specific needs or specific support that the person might need and want. Also, something to talk about is when that support would occur. So frequency and duration of that support. Doing this in advance is really going to help that person make an informed decision about the services and supports available to them. I do see that we've got someone raising a hand. Please do put your questions in the Q&A box that is at the bottom right-hand corner of your screen. If you've closed that box, you can find it again by clicking on the Q&A little tile and type your question into all all panelists, and we'll be able to take your question when we stop for questions. Thanks so much. Also included in backup planning is planning for other emergencies. So the document has to contain information and resources that people with disabilities and their families and service providers can use to become better informed and educated about how to best prepare for a broad range of disaster situations. So emergencies that might affect you and where you live, like a fire, or maybe weather emergencies that may be confined to local communities, or maybe more widespread, like summer or winter storms. Also thinking about emergencies that may affect a large section of the country, things like, bigger weather events or terrorist attack. Thinking about things like that, being prepared can greatly increase the safety of the folks that you work with, as well as yourself, thinking about backup planning in your life, and your ability to take care of yourself and to provide support for the people that we work with during and immediately after the disaster happens. We've got a link here on the slide to the Minnesota DDC emergency planning document. This has a lot of great information and great suggestions, something that I've actually read through and made some plans to start backup planning for my family. So do take a look because it's got a lot of great resources there. So case managers and care coordinators, do your due diligence. Have those conversations with folks and document what you talked about. Document what you offered, what you tried. Things don't always have to work perfectly, but having a plan in place can help, get us to the next step. Think about if you can leave that conversation knowing that you've reasonably balanced that person's health and safety with their dignity of risk. Thinking about backup plans, is the plan sufficient? How do I know it's enough? Because there is no checklist, there is no form. The backup plan is sufficient when the providers, the case manager, the care coordinator, and most importantly, the person feels comfortable. Really, when all that person's needs have been addressed. If you just type in call 911, that's not a sufficient backup plan for every situation and for that individual person. Now, call 911 may be most appropriate for certain situations, like, oh, there's a fire, but that can't be the entire breadth and width of backup planning with folks that we work with. So we are going to pause for a moment, and I am going to turn over a presentation to my panelists to see if there are any questions that have come in through the Q&A panel. Again, the Q&A panel is located on the bottom right-hand corner of your screen, or click the little Q&A tile in your WebEx, and you can set your question to ask all panelists, and we will be able to review those. So Megan, Victoria, Kathy, any questions that have come in?
Hi, Lauren, it's Megan. There's nothing yet, so we will keep a lookout though and keep monitoring for questions.
Excellent. Remember that if you've got a question, the Q&A panel is the place to put it. If you've got feedback for us, we want to hear that. We just want to hear it on our survey at the end of our presentation. All right, so moving forward, how to create a backup plan is our next topic. So, as with everything in support planning world, begin with a conversation with the person. Talk to that person, help them think about things like, who do I want to help me? If they do choose that informal supports will be their backup plan, make sure that you obtain a release to release information to those informal supports and reach out to that person's informal support system to talk about how much, what kind, and when they might be able to help that person. We've got some services that can help as well. So services that could help informal support, get it paid or get it trained. We do have some CVSM pages on these services. And all of these, again, are links that you can click on in the PDF copy of this presentation that was sent out if you pre-registered for this training. You can also Google Minnesota CVSM caregiver living expenses, for example, and that should come up in your Google search as well. All of these are also listed in the resources section at the end of this presentation. So thinking about staffing, walk that person through the question, if my provider is unable to help me, who's going to help me? Talk to the person's providers about any backup systems or policies they may already have in place to coordinate planning, and develop a plan for both short and long-term staffing backups. Some resources that can help, we've got some direct care workforce resources linked on this page, some remote support resources. Remote support's a great option if the person chooses. And we do also link to the CVSM page for the personal emergency response systems, or PERS systems, PERS devices, I guess. Think about assistive technology. Ask the person to think about, would access to accessible equipment or assistive technology help me? And if so, what kind of equipment might be helpful? So to ensure that the person receives the most customized and tailored equipment to meet their needs, it may be good to schedule a home and assistive technology assessment. We've got the process and the information for those linked here on the slides as well. So our guide to assistive technology. We've also got our CVSM page for environmental accessibility adaptations. Where to document a backup plan in the new MinChoices support plan. If this looks new to you, you may not be in the new MinChoices support plan. So just so you know, this is what that view is. This is one narrative box to explain the person's customized backup planning. This is in a section called My Plan to Address Safety Needs. If the person's assessment indicates that the person needs a 24-hour plan of care, then a little brown colored note will pop up indicating this, as you can see on the screenshot here. Again, this is in the safety and well-being section in My Plan to Address Safety Needs. This is our view of the MinChoices MCO HRA support plan. Again, new system. The user will need to select the services that the person will be accessing. So the support plan user needs to select the available service the person will access. And then all available services are listed on the left side. You click them and the service moves over to the right side. Really a cool feature. This is also a continuation of the MinChoices MCO or HRA support plan. This first box is a narrative spot to explain the person's customized backup planning. So under My Backup Plans, the Essential Services plan is listed there. Also, the MCO HRA support plan requires documentation of what the person's backup plan will be in the event of a community-wide disaster, which is why we bring this up. The community-wide disaster plan narrative there is where we would enter that. The last box is to indicate if the person needs help evacuating their home and potentially what that plan would look like. So my plan in an emergency, and then at the bottom here, if I am not able to evacuate on my own, I will. So another narrative section there. Weather and other natural and community emergency backup planning is required to complete the MCO HRA support plan. So we want to encourage you all to be creative when emergency backup planning or just regular backup planning. Case managers and care coordinators, just like the people that we work with, you guys have the right to take risks, the right to make mistakes, the right to try again. A person doesn't have to go back to a residential setting or a more restricted option because their first choice didn't work, or something like that. Let's get creative. If that option that they chose doesn't work, it doesn't mean it needs to be thrown out completely. Many times we can tweak it, we can find another solution, find another setting that can really be the difference. If you need help with this, a great opportunity to bring in person-centered planners. This is a good time. People can and should reflect on what works and what doesn't work for them, and can and should make changes to their plan as needed. So if the person that you support would like more opportunities for creativity and customized planning, as I suggested, offer facilitated person-centered planning. This can be authorized as family training and counseling. Whoops, missed a slide. We want to help people reduce their reliance on shift staff. So we want to engage in discussions with people to identify those natural supports that may already be supporting that person to meeting their needs. People and organizations may be able to support that person with additional exploration and additional planning. Talk about people with local resources, like local transportation resources, social groups, jobs, volunteer opportunities, computer access. We do have a list linked on this slide to a list of city and county websites that may be able to help folks to find things like this. Talk about assistive technology. Again, we've got eList here linked. That is ideas for lead agencies to help people access assistive technology. So some creative opportunities here. Explore if there's things that people might want to do on their own. People can request waiver services if they're interested in learning new skills. So things like independent living skills therapies or family training and counseling can help with that. Also, we need to be providing self-directed service and support options that give people choice and flexibility with their service options, including they could hire their own support staff. So people like their parents, their spouses, their relatives, or friends. We've got current options listed under our CDCS overview, our CSG overview, and our PCA choice overview as well. And explore working with a skilled facilitator to discover and identify a person's vision and direction for their life through person-centered planning. This facilitation is really a great service to bring in for a person who may need that extra creativity. We've got our CDSM page there as well. Let's talk a little bit about mandated reporting, because we know that that is something that we encounter in our jobs. So who are mandated reporters? Well, assessors, case managers, care coordinators, you guys are all mandated reporters. And there is a link here to specific mandated reporter requirements. Mandated reporters are required to report suspected maltreatments of a vulnerable adult immediately to the Minnesota Adult Abuse Reporting Center, or MARC. Phone reports can be made by calling the statewide toll-free number, and mandated reporters meet their reporting duty also by making a web report. So links are there too. You can also refer to the mandated reporter guide for information on using that web-based reporting system. Of course, if it's an emergency, call 911 before making a report if emergency response is needed from police, fire, or medical personnel. This is not a replacement for 911. We've also got links on this particular topic. DHS offers online mandated reporter training, which is linked here as well. We've got a reporter guide on the state's Vulnerable Adult Act, including a definition of who is a vulnerable adult, as well as definitions of maltreatment and the reporting duties of all mandated reporters. If you have any questions, review the DHS Adult Protection Policies and Procedure website. Not only are we mandated reporters for adults, but we are also mandated reporters for children. Neglect, physical abuse, mental injury, and sexual abuse are all considered child abuse in Minnesota, and each one of those is defined in state law. Neglect is the most common form of maltreatment that we see. So to learn more, take a look at the link that we've got here on the slide. Again, case managers, assessors, care coordinators are all required by law to report suspected child abuse or neglect. To report concerns about child abuse, neglect, or sexual abuse, contact the county or reservation where the child lives during business hours. To locate the appropriate contact number for that county or Tribal Nation reporting, take a look at the link that's underlined here on this slide, and I would bookmark that for future use. County and tribal child protection workers work with families to prevent child maltreatment, or in some cases, work with the courts and law enforcement to remove children from the home if they're in harm's way. As a reminder, when a child or adult is in immediate risk of harm, please dial your local law enforcement agencies or call 911. This is not a replacement for emergency situations. We've listed on this slide some of those child protection resources, a list of agencies, a list of programs and services. We've got also some mandated reporter training listed here as well. I'm sure you're all very familiar with this, but just in case, here are all of those resources so that you can take a look at those. We are going to pause for a moment again to check in with my fellow panelists to see if we've received any questions through the Q&A panel. Megan, Victoria, Kathy, anything come in?
Hi, Lauren. This is Megan. Just a second as I read. Okay. So we have a question that came in that says, what support services do you suggest when a person needs direct care and the staff person does not come, and maybe the PCA agency doesn't have any available staff at the moment, and no family members or friends available to help at the time. So as we've discussed in this presentation, it is really critical to have backup plans specific to staffing emergencies, staffing shortages, just with the number of direct support jobs that are currently available and needed. And I think everybody here knows and can kind of feel that direct support shortage. So that's why this is so important to talk about. And in a situation where a person requires that direct support, it's really critical to think about the backup plans prior to these situations where the person needs the support. So have a conversation with the person and consider who might be able to support the person and what support they need when they run into a situation like this. Perhaps what assistive technology can do to support the person when they don't have a direct support person available. Think about possibly some community organizations, people. Do they have a neighbor that can be on a list for them to support? Is there any available community organizations or churches that can help support the person? A friend that or a neighbor that they can call. So really it's important to think about and give the person kind of an informed choice of all their options. I know we've said before, but try to think outside the box and be creative about who might be available to provide support in these situations. What can assistive technology do? And then of course, reach out for help as needed with person-centered planning if we're running into situations where perhaps a person is not getting their needs met. And Victoria, did you want to add anything else to that question? I don't know.
No, I think you did a lovely job, Megan. Thank you.
Okay, yeah. And then we have another question that's specifically asking about compliance during the lead agency review process. Just that currently the backup planning is required for people who for people in general, and wondering kind of if this is going to be continued during the lead agency review process. And I'm not on that team, and so I'm not comfortable really speaking to what's in the future, but I will say that case managers and care coordinators really must discuss and develop emergency backup plans with the person and their legal representative if they have one. This is part of the entire support planning process and is required to make sure that people's support needs are met. And then let's see, Victoria, and then there's a couple questions about the support plan in the revised MnChoices system. If people don't have the specific plan where it's required, Victoria, can you speak about that a little bit more with where they can document the backup plan in those situations?
Yeah, Megan, I'm just clarifying. Are you talking about within the MCO and HRA plan with the community-wide disaster plan or the 24-hour plan of care?
So just the general support plan when the person doesn't require a 24 plan of care and they don't have the HRA MCO. There's a spot in the MnChoices support plan that Lauren went through a bit earlier. So
Yep.
just that piece.
Yeah, Lauren, can you maybe back up to slide 37? So for a regular MnChoices support plan, where you will find the backup planning is under the safety and well-being section, as you can see on the right side. I have it yellowed and highlighted. And it really is just a narrative box because we wanted to make sure that it was customized to the person because everybody's backup plan should be unique to that person's needs. The one thing that will roll over is from the assessment into the support plan is if the person does require a 24-hour plan of care, there'll be a little brown notation, as you can see with the exclamation mark, that this person requires a 24-hour plan of care. And I do believe you have to satisfy the narrative box to complete your support plan.
And then I think we have a couple more. I'm going to answer one that just came in about discussing. They said, do we have to discuss emergency-wide disasters on a general support plan? And the answer really to that is, maybe not everybody has to, but if it's really dependent on the person. So if the person, you know, lives in an area or wants to discuss a backup plan related to perhaps a severe weather emergency, and that would really help to make the person feel good and have a plan in place in those situations. That's important. It's really based on the person. And the person, sorry, I'm reading another question that came in, so I'm getting a little distracted. But it's really based on individual supports, whether or not the person needs to have, again, there's no checklist, so they're not going to have to go through and say, we need a backup plan for, a tornado or a flood. If the person's not living in an area where flooding is very common, then of course you would need to have a backup plan for that. So I hope that's helped support that question. But Lauren, we've gotten a couple more and I haven't read them yet. So I think we're at a good spot for you to continue. And we can always circle back.
Excellent. Great questions, everybody. And thank you so much for participating. I'm going to flip us back forward. Sorry for the moving through of slides here, but get us back to where we left off. We will have additional opportunities to get questions answered as we move forward. So don't worry, if your question didn't get answered, we're not done yet. So let's take a look here. We do have some examples that we've written up for us to take a look at. So let's talk through those. I hope you guys remember it's been a few months since we've reintroduced you to Jose. So if you don't remember Jose, we introduced him as kind of a persona that we're going to examine back in 2022. As a reminder, kind of just a little background on Jose. He lives in rural Minnesota and was recently determined eligible for the waiver and would like to continue living in his apartment on Main Street in his town. We discovered that to help Jose do this, we would really need to start planning by addressing the whole person. And that's planning that accounts for Jose, his family, his friends, and his community. It's planning that ensures services are not a barrier to his relationships, not a barrier to his daily life and his culture. He does have some complex needs related to diabetes and mobility, and his family is really concerned about his management of blood sugar and the big stairwell leading up to his apartment. They're concerned that he might have another seizure related to low blood sugar and fall. A little bit more about Jose. We've worked with Jose's persona to have him work with his case manager and talk about engage in the informed decision-making process about the people, the community services, the support services, and assistive technology that could provide him support. He's also worked with his case manager to identify specific support that each person, service, and support is going to provide to help Jose meet all of his assessed needs. And he's also worked with his case manager to discuss and document the details and responsibilities of support in the support plan. So now it's time to discuss and develop a backup plan with Jose for when maybe the original plan doesn't work out. So after some thorough planning, going through the informed decision-making process with his case manager and taking time to learn about and explore his options with the help of providers and experts, Jose has decided that he wants to use a combination of his natural support system and a smartphone app to monitor his blood glucose level. Jose's family will access Jose's charts from that app to help monitor overall trends. His case manager has documented that that is the specific support that the technology will provide to help meet his needs. The case managers also documented specific action steps and support instructions for Jose and others to monitor his technology and also an overall plan for monitoring it as a part of monitoring the support plan. So after that, it's time to think about the backup plan. What if it doesn't work? What if the technology fails or Jose's phone runs out of battery? So lots of considerations here. So remember, we want to get creative. Jose can choose informal supports and technology to support his needs as identified in the support plan. He can also choose informal supports and technology to provide backup support. So his case manager really needs to think outside the box. An important part of Jose's backup plan is that he wants his family to be available and alerted to monitor fails. Pardon me. And also to alert his caregivers if blood glucose levels get too low for him. His neighbor and friend has been trained to recognize the signs of severely low blood sugar and is available to receive alerts to his low blood sugar. That way, if Jose's having a busy day or if his phone is out of battery, his family members or his neighbor can come over to help him. Jose is also going to start carrying a medical alert card to instruct first responders and others on how best to help him in an emergency. Jose and his case manager also discussed what to do if the phone apps and monitoring technology don't provide enough support. Jose also wanted to review some available options for skilled nursing agencies and has chosen from, all of his options, an agency to call if he needs to have more support as his needs change. Jose's blood sugar management need went from really being a barrier to Jose to remain living in his apartment. And hopefully now it's a more manageable need that he's able to meet with informal support, family, and friends. and a backup plan if the original plan doesn't work out. So thinking about other situations, Jose and his case manager also wanted to create a backup plan for those situations. They identify people and family that can provide support, also their contact information that Jose is going to keep in his wallet. They also identified a designated meeting place near Jose's home with Jose's family in case they can't reach each other. Jose has contacted his doctor to approve 5 extra days of medication to have on hand in case one of these events takes place. And of course, Jose will still have his medical card on him at all times to help first responders. Because of all of his conversations with his case manager, Jose feels like he's prepared to continue to have his needs met in one of these situations, which is a huge part of backup planning. Another example, persona that we've worked with in the past, I hope you remember Myrtle. We introduced Myrtle again in 2022. As a little reminder of some background on Myrtle, she lives in the city near her daughter and her son. Because she had a recent fall, she and her support network of family and friends were concerned about her living alone. She agreed to wear a personal emergency response system, PERS watch, for her safety. She also began receiving homemaker services, and as part of that service, the homemaker reminds her to put her watch on every day. It's important for Myrtle to continue living in the home where she had lived with her husband. She had said that she would miss her close friend who visits her daily, and everyone was comfortable with this option. So in conversations with her case manager, she engaged in that informed decision-making process about the people, community, services, supports, and assistive technology that could provide her support. She's also identified the specific support that each person, service, and support will provide to help Myrtle meet her assessed needs, I should say Myrtle. She also discussed and documented the details and responsibilities of supports in her support plan. So now it's time for her to work with her case manager to plan a backup plan for when maybe those original plans don't work out. So Myrtle has chosen supports to support her desire to stay living in her home safety. She has chosen that personal emergency response system watch, that PERS watch. She's also chosen homemaker services to help remind her to wear her watch and also to help her with cooking and cleaning. So thinking about a backup plan, what if this doesn't work out? What if the technology fails? What if nobody shows up? We want to get creative. So remember, Myrtle can choose informal supports and technologies to support her needs in the support plan. She can also choose informal supports and technology to provide backup support. Thinking outside the box is really important. So let's talk a little bit about what Myrtle has chosen. So an important part of Myrtle's backup plan is that she wants her family and her friends to be available if homemaker services can't make it for their shift. Myrtle's family and her close friend who visits her on a daily basis were glad to help out as needed in this way. It gave them a way to continue to be involved with Myrtle's care, but not responsible for it on a daily basis. Myrtle's able to remain in her home at this time, and a backup plan is in place if the original plan doesn't work out. She's going to have her friends and her family kind of on call if the homemaker's not able to show up, and she's going to carry her cell phone with her in case her PERS her watch fails and she needs to call for help. So this is our last chance in this presentation for our question and answer. If you do have questions, again, please make sure to enter those in the Q&A panel that is located on the bottom right-hand corner of your screen. I'm going to pause and let our panelists let us know if any other questions have come in and if they have any answers to those questions. I'm going to go on mute and I'm going to stop my video so I can take a big drink of beverage and they can work on Q&A.
Hi, everyone. It's Megan again. We have a question here that says, does DHS have sample backup plans for case managers to review? And that's a great question. I hope that those examples from Jose and Myrtle helped, and hopefully you're able to go through the presentation PDF that was sent out and review those. a lot of considerations for backup planning are within those examples. So I think that would be a great resource. There is also a sample plan for somebody named Delford. And it's actually a pretty simple plan. I don't think the backup plan gets too in depth for that example. So, but I think Victoria, our support planning policy staff, can help maybe share that information or share where you can find that information.
Yeah, if you guys are looking for backup planning in the new Min Choices revision, Delford Johnson is the person's name, and you can find him within the MTZ training zone. It is a pretty simple plan. I do believe we are working on creating some more case examples to have available in the new revision.
I'm going through the Q&A here, and we have a few comments just in general, so nothing to answer there. Then I might reach out to somebody for more specific information about a person that they support. It seems a little bit specific. I'm not really seeing anything else at the moment, Lauren. Just
Sounds
double
good.
checking, but no, I just sorting through here. I don't see anything at the moment.
Sounds good. I'll check in with you again, Megan. Thanks for letting me go off camera to drink half of a Gatorade really quickly. Um, we'll come back to you if you do have additional questions that come in. So today we learned that backup planning is more than just directing someone to call 911. We want to create a backup plan because it's important to and for that person. We also talked about the responsibilities of a case manager or care coordinator as they relate to helping the person create a backup plan. Remember that if a person has time to think about an emergency backup plan before an emergency happens, they'll be able to receive their preferred support when that emergency occurs. They will have had time to think about their goals and their preferences and make a choice instead of feeling like they have no choice at all. So something new, we will not be having a Building Your Skills presentation in September. Our next presentation is in October. October's Building Your Skills episode will talk about service authorization and closing the plan. We will get an announcement out with our training e-list as we get a little bit closer to the webinar date. But if you have already signed up for the October session, again, October 25th, 2023, you can register for the session in TrainLink. Also, just looking ahead, we will also be skipping November and we will be having a December presentation. So those dates to sign up for October and December are available in TrainLink. You can register and sign up for those future presentations today. And we would love that if you did that in advance so that you can receive all of the materials sent to you before the presentation takes place. And we will be seeing you in October. Again, we always just want to close this out thanking you for the role that you play in the lives of the people that we serve. You and the job that you do is so important. You're really helping people to make informed decisions, feel like they have control and choice, and live that good life that we want everybody to live. You help ensure people to live the life that they want to live. So thank you so much for all of your hard work. I'm going to pause for a moment just to see, Megan, if any additional questions have come in.
Hello, Megan here. No, there's a couple comments I do want to note that are good considerations about. So again, we're really using this building your skills to get feedback too. So there's things I think we can go a little bit deeper on in the next trainings, and that's why we really like some comments and feedback throughout. So I appreciate that. As far as actual questions, I'm not seeing anything else at the moment. So I think we are good today. And of course, please use that DSD contact form if you need more support, whether that's for a specific person that you want a little bit more consult or guidance to help create a backup plan for, or just have specific questions, and then or if you have just general questions that weren't able to answer today. We tried to sort through them all, but yeah, thank you so much, everybody.
Thanks, Megan. And just as a reminder, the survey that we send out after this is going to auto pop up on your screen. So I'll get to a slide here in a moment that'll show you what that pop-up looks like. If you've got questions and feedbacks on things we should have covered in more detail or went deeper on, or if there's something that we missed, that's your real eager opportunity to let us know. And we need your feedback because we're not perfect. And you're our backup plan to make sure that we're getting this right. So please do fill that out and let us know what we can be doing better. Or if you liked what we did and you want to tell us, this is great, go a little deeper here, whatever. We want to hear your feedback. I'm going to just show you, we've got some resources here at the end of our presentation. So all of you that pre-registered should have received a PDF copy of this presentation. And so all of these links will be live in that PDF. So if you've got questions, all of these resources were pulled out of the slides and put at the back so that you could find them really easily. If you have questions, as Megan said, and get through all of these resources slide, please do let us know. Here is this slide telling what the little pop-up looks like right at the bottom right-hand corner of that slide. It'll pop up saying, there's an external site trying to open a website. Go ahead and hit continue. And that'll take you right to our survey form. Again, that'll appear up here once you close WebEx. We really appreciate that. If you have any questions that we didn't get to today, or you didn't want to ask in this forum, or if this made you think of something and it pops up in the middle of the day in your brain, direct those questions to the appropriate division contact. So the DSD contact form, or emailing Aging and Adult Services directly with questions. They will be routed directly to our team. The same folks that were on our call today are the same folks that research the answers to all of your questions that come in that way. So please do send those in and we can get right back to you directly. Today's presentation is going to be accessible on the training archive page. Again, if you want to access this, it should be up within the next couple of days, but all previous episodes are also up on that training archive page. Thanks again for attending this month's webinar. We'll see you in October. Enjoy the beginning of the school year for those of you that applies to. For the rest of you that it doesn't apply to, let's all enjoy the weather getting a little cooler. I'm a big fall person, so pretty excited about that. Have a great Labor Day weekend. Thanks for spending your time with us this morning. And that's the end of our presentation today. Thanks again.